Medications like sildenafil, Viagra, and tadalafil, Cialis, can be effective treatments for erectile dysfunction, ED, but they may not always work immediately or for everyone. Here are some common reasons why these medications might fail, especially on the first try. Incorrect timing. Both sildenafil and tadalafil require timing to be effective. Sildenafil typically works best when taken about 30 minutes to 1 hour before sexual activity, and tadalafil can be taken 30 minutes before but is also available as a daily low-dose option. If the medication isn't taken at the right time, it might not work properly. Lack of sexual stimulation. These medications are not automatic aphrodisiacs. They work by increasing blood flow to the penis in response to sexual arousal. If there is no sexual stimulation, the medication won't trigger an erection. Inadequate dosage. For some individuals, the starting dose may be too low to be effective. Sildenafil doses can range from 25 mg to 100 mg, and tadalafil doses can range from 5 mg to 20 mg. If the initial dose is too low, the medication might not produce the desired effects. Food and alcohol consumption. Sildenafil, in particular, can be less effective if taken with a heavy or high-fat meal, which slows down absorption. Alcohol can also interfere with the effectiveness of both sildenafil and tadalafil, as it impairs the ability to get and maintain an erection. Underlying health conditions. ED can be caused by various factors like cardiovascular disease, diabetes, high blood pressure, or hormonal imbalances. These conditions might reduce the effectiveness of ED medications if they are not well controlled. Psychological factors. Anxiety, stress, and performance pressure can all affect the effectiveness of ED medications. Even if the drug is working properly, psychological factors can inhibit the ability to achieve or maintain an erection. Tolerance over time. In some cases, patients may develop a tolerance to ED medications, especially if taken regularly over time, making them less effective. Optimizing success. Proven ways to increase the efficacy of ED medications ensure proper timing. For sildenafil, take it 30 minutes to 1 hour before sexual activity, and avoid taking it after a heavy or fatty meal. Tadalafil can be taken 30 minutes prior, but its long half-life, up to 36 hours, makes it suitable for spontaneous intercourse, especially if using the daily low-dose form. Be aware of your diet. Avoid heavy meals, especially high-fat foods, before taking sildenafil as it can delay the drug's onset of action. Limit alcohol consumption, as alcohol can lower your sexual performance and reduce the effectiveness of ED medications. Increase dosage gradually, under medical supervision. If the medication isn't working, talk to your doctor about increasing the dose. For instance, sildenafil can be increased from 50 mg to 100 mg, and tadalafil from 10 mg to 20 mg, but this must be done under medical advice. Manage underlying health conditions. Conditions like diabetes, high blood pressure, or cardiovascular disease can impact the effectiveness of ED medications. Managing these conditions through lifestyle changes or medication may improve the effectiveness of ED drugs. Optimizing testosterone levels can also improve erectile function for those with low testosterone. Psychological support. Addressing stress, anxiety, or performance issues can make ED medications work better. Techniques like mindfulness, therapy, or even open communication with your partner can alleviate psychological barriers. Exercise and healthy lifestyle. Regular physical activity improves cardiovascular health, which in turn enhances blood flow, making ED medications more effective. Stopping smoking and reducing alcohol consumption can also help improve the medication's efficacy by improving blood flow and hormonal balance. Crucial do's and don'ts. Important factors for optimizing ED medication effectiveness. Dose. Do take the medication at the right time. Make sure you follow the instructions regarding when to take the medication relative to sexual activity. Do stick to the prescribed dose. Follow your doctor's advice about the correct dose to take. If the medication isn't working, discuss dose adjustments with your doctor rather than self-adjusting. Do stay physically active. Engaging in regular exercise improves circulation, which may enhance the effectiveness of ED medications. Do monitor your diet. Pay attention to how food and drink may impact absorption. Fatty meals can reduce the effectiveness of sildenafil, while moderate alcohol consumption may be acceptable but not excessive. Do communicate with your doctor. If the medication doesn't work initially, don't give up. Sometimes, it takes a few tries to work. Discuss the issue with your healthcare provider to find an appropriate solution. Don'ts. Don't mix with certain medications. ED drugs can interact with nitrates, used for chest pain, or alpha blockers, used for high blood pressure, potentially causing dangerous drops in blood pressure. Always inform your doctor about any medications you are taking. Don't take with excessive alcohol. While a small amount of alcohol may not affect these drugs, excessive drinking can impede the ability to get an erection and reduce the drug's effectiveness. Don't give up after one failure. It's common for ED medications to require a few attempts before achieving optimal results. Don't stop after one try if it doesn't work. Talk to your doctor about possible adjustments. Don't overlook emotional factors. Psychological elements like stress and anxiety play a huge role in erectile function. Ignoring these factors can limit the effectiveness of the medications. Don't ignore your overall health. ED can be a sign of underlying health issues like cardiovascular disease, so it's important to maintain regular checkups and manage chronic conditions. By optimizing dosage, timing, and lifestyle factors, and ensuring that any underlying health or psychological issues are managed, you can improve the success rate of sildenafil and tadalafil in treating erectile dysfunction.